Hello, welcome to the second episode of Le Nouveau Esprit Presents on Marijuana. Our task in this video is to briefly examine some of the medical evidence about what marijuana does and does not do to the human person. This topic is quite muddled today because marijuana has many advocates on its behalf who ascribe to this herb several unfounded medical claims. If you have watched our previous episode, then you know that the Catholic Church actually understands marijuana to be a very dangerous substance and has judged its usage outside of medical purposes to be immoral. We want to now explore why the Church would consider marijuana to be dangerous like cocaine or heroin. I first want to mention some notable sources I found helpful for our topic. So we have Marijuana Debunked by Ed Gogic, Tell Your Children by Alex Berenson, The Dangers and Consequences of Marijuana Abuse published by the DEA, Lessons Learned from Marijuana Legalization for U.S. States and D.C. by Smart Approaches to Marijuana, and The Health Effects of Cannabis and Cannabinoids by the National Academies of Sciences, Engineering, and Medicine. I will refer to this as the NOM report. Alright, so the two most commonly known compounds in marijuana are cannabidiol, otherwise known as CBD, and delta-9-tetrahydrocannabinol, otherwise known as THC. THC is responsible for marijuana's high, while CBD is generally identified by advocates to be medically significant, despite the FDA stating the opposite. Many marijuana products have low levels to no CBD and high levels of THC of 25% or more, depending on the type of product. In the 1970s, a joint had about 2% THC concentration. What many do not realize, however, is that today a joint has a THC concentration of 25% or higher. Other cannabis products, such as wax and shatter, can be pure or near pure THC. Marijuana today is more than 12 times potent than it was 50 years ago. We also want to note that some researchers argue that 2.5 milligrams of THC is equivalent to one alcoholic drink, and that normal marijuana usage is about 100 milligrams of THC. This is equivalent to 40 drinks. Now, this may sound like a lot, but suppose one used, say, only 20 milligrams of THC. Well, this is still 8 drinks. Now, the chemical structure of THC is similar to anandamide, I think I butchered that, which is a neurotransmitter. Anandamide affects the parts of the brain responsible for pleasure, memory, thinking, concentration, movement, coordination, sense perception, and time perception. Due to THC's similarity with anandamide, it can attach to neurons and activate them in the same way as anandamide. THC, for example, is capable of disrupting the hippocampus' functionality and the orbital frontal cortex. These parts of the brain enable the formation of new memories and the ability to shift attentional focus. And so THC alters these parts of the brain since THC alters these parts of the brain, this means that marijuana can affect a person's memory, impair thinking, ability to learn, and perform complicated tasks. THC also alters the functioning of the basal ganglia and cerebellum. These are the parts of the brain responsible for regulating balance, posture, coordination, and reaction time. This means that marijuana users cannot safely operate machinery or drive motorized vehicles and have problems performing physical activities such as sports. THC also activates the brain's reward center, releasing dopamine. It is this effect that marijuana users seek when desiring to get high. This is also what makes marijuana potentially addictive and in part a psychostimulant. Now, it is a common myth perpetuated by cannabis advocates that one does not get addicted to marijuana, but this is certainly not the case. Marijuana, according to some researchers, has an addiction rate of 30%. The DEA reported that from 1998 to 2008, the treatment admission rate for marijuana abuse rose 30% nationally, and in California, 117%. In 2012, marijuana accounted for 60% of all drug dependence or abuse of all illicit drug use. More sobering is the fact that in 2011, 40% of primary marijuana treatment admissions were under the age of 20, and that 32% of treatment admissions had first used marijuana by the age of 14. The NOM report concluded that there is substantial evidence of a correlation between the frequency of cannabis use and becoming a marijuana addict. Now, while marijuana is not physically toxic like other substances, it does cause a mainly psychological dependency. Research shows that cannabis withdrawal can have the following symptoms, including anger, aggression, decreased appetite, irritability, nervousness, anxiety, restlessness, sleep difficulties, chills, depression, stomach pain, sweating, and shakiness. We want to note now that several medical authorities, such as the American Academy of Pediatrics, Glaucoma Research Foundation, and American Society of Addiction Medicine, have stated that marijuana should not be smoked, period, because this activity has several adverse respiratory health consequences. Marijuana smoke contains toxic chemicals such as ammonia, benzene, toluene, and naphthalene, and levels greater than marijuana smoke, making marijuana smoke a significant risk factor for several respiratory illnesses. The NOM report concluded that there may be a link between smoking marijuana occasionally and an increased risk of chronic obstructive pulmonary disease, which causes irreversible lung damage, and that there is substantial evidence of a link between smoking marijuana long-term and worse respiratory symptoms such as injured airways, coughing, phlegm wheeze, and chronic bronchitis. Now, the teenager's brain is still developing. The brain does not finish developing until one reaches his or her mid-20s, and thereafter the brain remains plastic and malleable throughout most of adulthood. During development, the brain establishes synapses based around skills through one's daily activities. These stimulate the brain's pleasure center, and hence one's life activities are in a sense programmed into the brain. Drugs introduce a short circuit into the brain's pleasure center, i.e. the limbic system. These shortcuts create brain circuits centered on drug usage. This means that the brain can literally become hardwired towards drug usage instead of ordinary healthy life activities. Teenagers are hence at a greater risk for becoming addicted to drugs, abuse other substances, and have a more difficult time leading a healthy lifestyle since these synapses are underdeveloped or eliminated. Keep in mind that most marijuana users start before they reach the age of 18, and 1/4 of all cannabis users start by the time they reach 15 years of age. Note that the person remains a free, rational person. Drugs impair one's ability to live as such, but he or she still retains his or her personhood and freedom to abuse or reject drugs. All right. Now, a study by Duke University showed that cannabis smokers who started before the age of 17 had smaller brains and less gray matter. Gray matter includes the thinking part of the brain controlling decision making and self-control. That means that This means that cannabis users who started as teens can have cognitive problems and issues controlling their behavior. The University of California at San Diego conducted a study showing that teens who were heavy marijuana users performed worse on neurocognitive tests, including attention, memory, and planning ability, in comparison to those who never used marijuana. And this was after they were abstinent for 1 month. A Harvard study similarly found that heavy marijuana users who started before the age of 16 performed worse in executive functions such as solving problems, discerning patterns, and controlling impulses versus those who never smoked marijuana or did so at a later age. And we can also note that there was another study that showed that those who used marijuana before 18 lost an average of 8 IQ points. Concerning academic performance, a major study followed 1,000 people from the age of 15 to 25. The researchers showed that the number of times marijuana was used was inversely proportional to obtaining a bachelor's degree. In other words, the more one used marijuana, the less likely he or she graduated college. The graduation rate, in fact, drops quite significantly. So, those who use marijuana over 400 times those who use cannabis 200 to 399 times had a graduation rate of 10%, whereas those who used it over 400 times had a graduation rate of 2%. In comparison, 1/3 of non-users and 1/4 of occasional users graduated college. The researchers tested 16 variables for explanation and found that the pattern remained consistent regardless. The NOM report concluded that there is moderate evidence of an association between marijuana usage and impairment in learning, memory, and attention, and limited evidence of an impairment of the three once an individual stopped smoking marijuana for an extended period of time. Earlier we mentioned that studies showed that marijuana impaired the part of the brain which determines one's self-control. This means that there can be possible problems concerning cannabis-induced violence. One study showed that those addicted to cannabis were more prone to violence independently of other psychiatric problems and drug abuse. Those who have schizophrenia and are substance abusers are significantly likely to become more violent. And here are some examples where we have a situation of the perpetrator being on marijuana. So Nicholas Cruz was a marijuana user, and he killed 17 people and injured 17 more in Parkland, Florida. The Boston Marathon bombers were marijuana users and killed 3 and injured over 250 more. James Holmes was another marijuana user. He killed 12 and injured 70 in Aurora, Colorado. I list many more examples in my research on our website. I do acknowledge that in each case there are several other factors involved. What is pointed out here is that there is a correlation that raises questions concerning the causes and whether marijuana is a statistically significant predictor for violence. Alright. So now we want to talk about marijuana being in fact a gateway drug. One study showed a strong relationship between cocaine and marijuana abuse. 62% of those who used cocaine started using marijuana before they reached 15 years of age. In comparison, less than 1% of adults who never tried marijuana used cocaine. This means that over 99% of cocaine users had either tried marijuana at some point in their lives while on cocaine or first started out using marijuana and then moved on to cocaine. The National Center of Addiction and Substance Abuse at Columbia University reported that teens who used marijuana at least once a month were 26 times likelier to abuse other drugs such as meth, cocaine, and heroin versus those who never used it. The NOM report concluded that there is moderate evidence of a statistical association between marijuana use and becoming addicted to and abusing other drugs, including tobacco, alcohol, and illicit drugs. Several studies have also shown a correlation between marijuana usage and impaired thinking. One study in Nova Scotia found that marijuana alone was associated with a 4-fold increased rate of collisions. Another study showed that heavy marijuana users were 9 times more likely to become injured in a car accident. It should come as no surprise that since Colorado's legalization of marijuana, the number of traffic fatalities due to cannabis-impaired drivers doubled. The NOM report, after surveying the research on this topic, concluded that there is substantial evidence of a statistical link between cannabis users and increased risk of vehicle accidents. So, marijuana is hailed as a miracle drug by many advocates that can cure several diseases and manage chronic pain. However, research has not given support for the majority of these claims of medical benefit. A recent 4-year Australian study, for example, that looked at 1,500 patients, suggests that marijuana may not only be of no benefit to pain management, but even make symptoms worse and have no impact on opioid usage. If this is true, then 2 arguments for marijuana's legalization have been effectively undermined. For advocates argue that 1, marijuana can manage pain, and 2, help relieve the opioid crisis. The NOM report on marijuana is monumental. Is a monumental work in the marijuana literature, for it dissects the medical research on marijuana across many topics and spans thousands of research papers. It is an unparalleled source of information for our topic. We will note some of its conclusions. Keep in mind that we are being brief here, and I refer to the viewer to both my research and the NOM report itself for further details. The NOM report found that there is insufficient evidence to make any statement on the efficacy of marijuana in cancer and glioma treatment, AIDS wasting syndrome, cancer-associated anorexia, cachexia syndrome, anorexia nervosa, and irritable bowel syndrome. Similar conclusions that marijuana is an effective treatment for the following is of either limited or no evidence. And this includes spasticity due to spinal cord injury, Tourette syndrome, amyotrophic lateral sclerosis, Huntington's disease, Parkinson's disease, and dystonia. Evidence suggests that marijuana is ineffective for treating dementia and glaucoma. Both the American Glaucoma Society and the Canadian Glaucoma Society advise against using marijuana for treating glaucoma. Alright. Long-term usage of marijuana shows good evidence that daily cannabis usage has a correlation with increasing anxiety symptoms. Heavy usage is associated with social phobia disorder and an increased risk of social anxiety disorder. Further, there is moderate evidence that cannabis usage can increase the risk of developing depression. The NOM report report concluded that there is limited evidence that cannabis usage may actually increase the severity of PTSD symptoms, moderate evidence between marijuana use and suffering an increased severity of PTSD symptoms, substantial evidence between cannabis usage and the development of schizophrenia and psychosis, noting that heavy users are at a higher risk, that there is limited evidence of that regular or daily marijuana users are at greater risk for developing bipolar disorder, moderate evidence that marijuana increases symptoms of mania and hypomania in bipolar patients, and moderate evidence of a statistical association between marijuana usage and increased incidences of suicide ideation, suicide attempts, and increased suicide completions. Marijuana has been given an excellent propaganda machine by advocates who claim that marijuana is a medically significant drug. The NOM report amongst the other cited medical sources present a different story. Some of the claims made about marijuana are bold-faced lies, such as the supposed safety of driving after marijuana consumption and its proposed medical benefits for several maladies. Most of the medical claims about marijuana at this point are either erroneous or lacking sufficient information. We can conclude, however, that marijuana is in fact a dangerous substance given its impact on our psychological health. Thank you for watching this video. If you enjoyed the contents of this video and want to dive deeper, you can find more information about this material on our website. This video corresponds to part 2 of 5 of a whole series of articles dedicated to the question of Catholicism, drugs, and marijuana, and the links are provided here and below in the video description. If you wish to support us, please subscribe to our channel, join our mailing list, and consider making a donation. We accept PayPal donations on our website and have a Patreon page where you can support us monthly and access special perks. Financial contributions go towards maintaining our website and purchasing required materials for our research. If you're interested in learning more about why the Catholic Church condemns recreational marijuana usage, check out our previous episode. In the next episode, we will take up the question whether a Catholic can treat marijuana like alcohol. Thank you.